Have you ever lost a tooth and you thought, oh, well, it's not a big deal, it's just one tooth, who cares? Well, what if I tell you that losing a tooth is not really just for looks, but also it can affect your overall health, and that replacing teeth, it should be done immediately. My name is Dr. Radwa Saad, and welcome to this new episode of the Wonder Tooth Podcast. And make sure you put code 68 to get a free consultation for teeth whitening or even dental implants from our office in Princeton, New Jersey. So a little bit about myself. My name is Dr. Saad. I am a licensed dentist in the United States as well as in Canada. I worked in both countries. And I have a beautiful practice in Princeton, New Jersey, Blanche Dental. So if you're looking for a dentist, or if you're in the area, or if you need like a consultation, make sure you drop a comment down below. And, I'm here to help and to share some of my knowledge. So let's talk about teeth. What's going on? What's going to happen if you lose a tooth? Okay, did you guys know once a tooth is removed that the bone that's holding that tooth starts to shrink immediately? And I mean, within 1 year, you lose 25% of that jawbone width, which is pretty big. So, your jaw here, you have a certain thickness and a certain height. So unless if you get what we call a bone graft, like, in anticipation, you're going to get an implant in the future. So the bone, if there is nothing holding it, there is no root or nothing, it just starts to collapse. It starts to shrink. And not only just the bone, but also the gum around it, it starts to shrink as well. And why is that? Because the root, it kind of holds the bone around it, using the periodontal ligament. So as long as this is out, then everything starts to shrink. So what happens after that, the bone starts to resorb, and then it's usually, when you have you're starting to train your jaw or you train your arm, and it's become a little thicker. So if there are no teeth, it starts to thin out, and that's basically also it's resorbing. And what can happen after that, the teeth, the surrounding teeth, there's like, oh, I have a big space here, let me move around. So it's not just that one tooth is out, but the two teeth on each side, they start to tilt. They start to tilt a little bit, trying to close the gap. And the tooth on the opposing side, which is like if it's a bottom tooth that's missing, the tooth on the top is gonna start to over erupt. That's what they do. They start to over erupt, trying to meet a tooth on the bottom. So it kind of changes the whole dynamics of your chewing ability, but also of a lot of other stuff. So let's talk a little bit about the bone loss. So as I said, it starts to be lost immediately, and usually around 4 weeks after an extraction, the bone basically stop resorbing more. But then if you don't put anything there, it starts to shrink, but on the inside of the bone. And then the teeth, they start to shift, and then you start to have problems in chewing. Chewing starts to become a big problem, because especially if you're losing teeth in the back. If you're losing teeth in the front, that can be a big problem with the speech. Have you seen some people, they have hard time, talking because of the speech problem. And that also because the speech, the pronunciation of certain letters is actually it's affected by the angulation of your top and bottom teeth, and also the space between them. So it's very important when we are, as dentists, are making dentures for patients, we have to make sure that the top and bottom front teeth are set up correctly, so that their speech, their phonetics is correct, or basically you can understand them when they're talking. And also when you start to have teeth in the back here, in the posterior area, extracted, your cheekbone starts to basically, you start to see this. The teeth, the shape of your face starts to become different. So I've had patients who come to me and they're like, this is how I used to look like, 20 years ago, and my face now is all like wrinkled up. Then you start to see a little bit around the lips here, some, commissures basically, because you're losing the bone, and you're also losing the relationship between top jaw and lower jaw. So basically, instead of biting like this, you're over biting now. So your whole bite is collapsing. And that can cause tremendous problems down the line with TMJ and ear pain and headaches, and the whole, muscles of mastication starts to get tired, and also your lower jaw start to move forward. And why is that? Because it's trying to compensate. So have you seen, patients or people, the lower jaw is trying to kind of push forward because, we have missing teeth in the back here. We're trying to chew and then start to chew on your front teeth. And this is when your front teeth are not really designed for this. So they start to crack, start to break, and then we have more problems. So it's very important, really, if you have a tooth that's going to be extracted, you really have to talk to your dentist about what's going to be the alternative now. Like, I'm going to miss a tooth, and then what? Wisdom teeth, I don't really care much about them. They're all the way in the back, especially if you have the rest of your teeth. So this is wisdom teeth. If they need to be taken out, that's not a problem. Have them out. But the rest of your teeth, we need to keep them. And if you cannot keep them for any reason, they cracked or they're excessive decay, they cannot be restored, or you had a root canal and failed, or a bacteria or something, and the tooth has to be removed, or gum disease. Okay, the tooth is out. Now what? We have to kind of restore your jaw. It's not really restoring a tooth. You're restoring your whole face and your jaw. So there are different alternatives to do that. And why do we need to do that? Because a lot of patients or people, around you, they will say, I cannot chew. I cannot taste my food properly. And I cannot chew properly. And I always have now the indigestion. And why is that? Well, your teeth are basically, they start to break down your food into, little chunks, and the saliva kind of go and, they produce enzymes, and that helps in the digestion. So if you don't have, your natural teeth or implants or dentures or something to chew them properly, we have a lot of indigestions. And when that happens, okay, I don't want to now chew hard food, so I'm going to switch to softer food. And with softer food, we have more problems. Just like, the modern era we're living in now. So soft food can lead to actually more gum disease and more caries because they're softer, they're hard to clean. The more you eat like raw food or raw vegetables, it's much better for your health and for the health of your teeth. But if you start to eat like softer diet, then this is a big problem that can cause cavities, gum disease even, and diabetes can just kind of go crazy. So this is another issue. And with that, softer food, then, you're gaining weight, and it's like, I don't know what's going on. I'm not eating that much, but you're eating, the improper nutrition is going. And as I said, the speech problem. So the alternative nows are what? We have really 3 options. The best option, in my opinion, as a dentist who've been doing this for over 20 years, is to get implants. And implants basically is, you don't touch the teeth on the side. We are only dealing with that particular one tooth that's missing or few teeth that are missing, but we don't touch, so we don't rely on anything else. So let's say I have no teeth, I have a complete upper, complete lower denture. The dentures now are loose, there is no bone. This is, we can talk about what we call an overdenture. Basically, we put implants and we kind of put the little indentations inside in the inside part or the fitting part of the denture, and it kind of clips on top of the implant. It's called an overdenture. So option number 1 is dentures. Let's say you are missing one tooth or a couple of teeth. The best is to get a couple of implants. We don't touch the teeth on the side. I always say it's a 1 tooth problem rather than 3 teeth or 4 teeth problem. Of course, if you have good bone too, because the bone is the big factor here. It's not the biggest factor. And of course that you are healthy. Make sure you listen to one of the episodes about dental implants to listen, what are the criteria to become a good candidate for implants. Anybody can get implants, but how to maintain them, and if you don't have any immunologic disorder or immunosuppressant, medications, it could be a little tricky. So make sure you listen to that episode. So, okay, implants, I cannot afford implant. It's too expensive. I cannot do that. What's the other alternative? Well, Especially also implants are done over a period of time. They take sometimes up to 6 months, sometimes even more to be done. I need my front tooth fixed like right now. I don't care about implants. So your alternative would be maybe a bridge. What is a bridge? So the 2 teeth on the side now, okay, I need to put something in the middle. So the missing tooth in the middle, and there are 2 teeth on the side. So what do? I go and I shave this one and I shave the other one. I make them like smaller teeth. And then it's a one single framework that goes on top of the teeth. So it goes on the front tooth and on the back tooth, and there is a tooth in the middle, and it's a framework. It's glued on your teeth. It's fixed. Okay, so this is what's a bridge. A puente. It's a bridge. You still have to clean, and basically to clean under the bridge is a little tricky because you need to use what's called a floss threader, and it's a little plastic thing that you hook the floss in it, and you go where the missing teeth is, and you basically have to, even though it's seated completely on the gum, but sometimes plaque, and food debris sometimes can get in there, and that can cause inflammation in the gum and also decay sometimes on the 2 teeth underneath the gum. So you gotta make sure this is really clean. It's a good option. I mean, bridges are a good option as well, and they can be done like, on the same day. We do them on the same day in our office because we have the technology. So talked about implants, and then we talked about a bridge. What's the other alternative? It's a denture or removable, not a complete denture. Sometimes it could be a partial denture. Now, if you never had any partial denture at all in your life, I would recommend you kind of try to stay away from it because it's not for everybody. For example, some patients, especially if it's in the top and they have, a couple of missing teeth here, couple of missing teeth here. I don't want an implant. It's too expensive. I don't want a bridge. It's still expensive. Of course, the cheapest option is a partial. It's not that cheap, but it's still cheaper, the cheapest option. We give them now the partial denture, which basically how the 2 teeth on this side are going to be connected to the 2 teeth on the side. Well, it's going to go up in the roof of your mouth. If we're doing a resin base, which is like a plastic one, it's going to be like a thick plastic thing that goes up in the roof of your mouth. Or if it's a cast, which is like the higher end one, it's going to be like a couple of metal thing crossing the roof of your mouth. Now, some patients cannot talk about, they can't. Some people gag. So now we made the partial and they put it in and they're gagging and it's not working for them. Or even worse, you're putting it in and you can't talk. Ugh, the speech is not okay. Your tongue is not used to it. And then they start to, okay, I don't want to wear this. This is not for me. Oh my God. Okay, now even though we tell them all the options, but now you're literally kind of throwing your money on, in the garbage, really. So the bottom are even harder than the top. And why is that? Because if we have a missing teeth here and here, so something has to go now under the tongue. So imagine the roof of your mouth is much bigger. Here, it's much smaller, and the tongue is gonna drive you crazy. Ask me how I know, because some of the patients is like, I can't. And then they keep pushing it, and it's like, I can't use this anymore. So make sure, if you are really considering something like this, to know exactly where you are going. And if you're okay with it, then definitely 100% get it done. But if you cannot do it, or if you've never had any experience with that before, try to consider a bridge or implants. A bridge also cannot be used with everybody, because especially if you have no teeth in the back at all. So if we're trying to put, you need to have 2 teeth at least from each side so that we can put a bridge. Or a cantilever, I'm not a big fan of it, but at least 2 teeth in the front and 1 in the back, just kind of held in the back. So these are the options. And what else? Nothing is an option too. But with that, the rest of your teeth are gonna start to shift, and that can be really a problem in the future. So I had a patient last week. Her tooth, she has a missing tooth, a missing molar. The tooth behind it now is completely tilted. So the gum is like this and the tooth is like this, literally completely tilted like that. And now she's getting a lot of plaque and debris stuck underneath it. And I'm like, I cannot fix it. I cannot even do a bridge. Even though I have a tooth here in the back and the other one is still holding up, I can't, because the minute I start to shave it down, I'm going to end up into the nerve right away. So I said, well, it's going to be whether an elective root canal to be able to put a bridge, or just get the tooth out. So now she's gonna lose another tooth because it's very hard to maintain that. It's impossible actually to maintain that. So remember, losing one tooth is not really losing one tooth. You end up losing more. You end up losing the one on the top that's gonna start to over erupt to try to meet the tooth, and it's like nothing in there. So you end up losing the one on the top as well, because once the tooth, starts to grow down, so the contact between the two teeth starts to become different, and you start to get food stuck in between them. And then you're also losing the supporting structures of the tooth. Not only that, but we don't want teeth to start hitting the gums on the opposing side. So top teeth hitting the gum on the bottom, that can become very dangerous down the line, because that's basically chronic irritation. Chronic irritation can cause cancer. That's why I said in the very beginning that it can really affect your overall health, okay? So we don't like that. If you have a tooth that's already hitting in the gum, like hitting the opposing side, get rid of it. It's not really worth keeping it at this point, okay? I hope you kind of enjoyed this, and I hope you understand now it's very important when you have a tooth pulled to have a strategy how we are going to save it. If it's a wisdom tooth, forget about it. It's not really important. But if it's more teeth in the front, so remember, you're going to have bone loss, facial changes, phonetic and indigestion, and a lot of problems down the line too, because your jaw basically is going to start to change and move forward to be able to compensate for the loss of the teeth in the back. I hope you enjoyed this episode, and I hope you are going to keep your teeth happy and healthy. And how we're gonna do this, we're gonna brush twice a day, 2 minutes each day, 2 minutes each time, not every day, no. 2 minutes in the morning, 2 minutes in the evening, and we're gonna floss really well around every single tooth. And if you wanna really give them the spa feeling, use a little water pick to kind of give them a little, make them fresh. And a little bit of warm salt water helps too, okay? And of course, you have to go to your 6 month or 3 month, depending on how often you go for your dental cleanings and dental checkups. And x-rays are very important too, to have them at least be taken once a year at least, so that we can monitor the bone and the gum, and if there are any signs of gum disease or cavities, or okay? And if you need any consultation, I am here to help. Make sure you drop me a comment below and let me know, what you need. And make sure you take care of your teeth so that they can take care of you. Keep smiling with Dr. Saad. Have a good one, everybody.